The CDC Foundation Hero Award honors people who've had exemplary, world-changing accomplishments in global health and public health. And the type of individual we seek are people who've been able to use their leadership and their influence to solve some of the most intractable, unsolvable health problems. Well, Jimmy Carter has done something that I think many people, including myself, admire. He was the head of state in the United States. Some might argue the President of the United States is the most powerful position in the world. But when that was done, he turned his capabilities and his attention and utilized his influence to accomplish good in even a broader way around the world by focusing on neglected tropical diseases and accomplishing things through the Carter Center that otherwise could not have been accomplished.
President Carter has done so much for the guinea worm campaign. He really is, in my opinion, sort of the face of that effort. Not many people have the ability to meet as a peer with a head of state in the morning, and then in that afternoon have rolled up his sleeves and be out in an endemic village talking about guinea worm disease with the affected population.
It's through the leadership and vision of President Carter and the Carter Center that the great gains of the guinea worm program have been achieved. And through January to August of 2012, only 498 cases have been reported worldwide, so we are this close. Eradication means the permanent reduction of worldwide cases to zero so that governments don't have to provide routine interventions to prevent diseases from occurring. The World Health Assembly targeted guinea worm disease for eradication because the life cycle is known to scientists, it's not transmitted from person to person, and we have effective interventions and surveillance strategies to combat the disease.
Conditions in which people are born, in which they grow and learn and work and age, are more important for health outcomes than health care. And I think if you look at what's happened with guinea worm disease, President Carter and his team have demonstrated an understanding of that.
The eradication of guinea worm has been one of the major challenges of the Carter Center because this is such a horrible disease and is in such remote villages that no one else ever wanted to tackle it. So now we know every case left on earth, and we're just on the verge of complete eradication of this disease from the face of the earth. And this will be the second disease in history ever completely eradicated. So you can see that the transformation of a village population, many of which had 2/3 of the people suffering from this horrible worm coming out of their bodies, and now they're completely free of the disease. After 1 year of effort on their part, guided by us, is one of the most gratifying experiences of my life.
An eradication program is such a huge undertaking that no single entity could complete this goal by themselves. It really does require a partnership, a coalition of organizations and people.
Well, there are a lot of partners involved in eradicating guinea worm. CDC brings technical skills, we bring laboratory support, but really it's the Carter Center that has people on the ground at the end of the road in endemic villages that are seeing these cases and containing them. To me, that really is what it means to be the lead implementing agency.
Well, President Carter's a hero, in my opinion, because he's done something that all of us should truly admire. He's a hero because he put his efforts into addressing diseases that otherwise would have been overlooked.
Carter represents the mission of the CDC as well as anyone I can think of. His commitment to promoting and protecting the health of people throughout the world and preventing disease and their complications has really been exemplary.
The promising thing is that these diseases are all preventable because we've proven that in the rich world. If the folks are just given a chance to know what they can do to improve their own lives and given them mechanism or medicines or education to do it, then they can transform their own lives into an opportunity for hope and self-respect, decency, and anticipation of a better future.